I'm Brian O'Connor. I'm a consultant respiratory physician in private practice at Bupa Cromwell Hospital, and I'm chair of the Medical Advisory Board. In common with other independent hospitals, Bupa Cromwell Hospital has joined with the NHS to fight the Covid-19 crisis by providing access to all patients, whether NHS or private, for urgent medical and surgical care. Whilst continuing to support the NHS in the fight against COVID, Bupa Cromwell Hospital remains open to private patients who are encouraged to come to the hospital on the basis of clinical need, and the hospital continues to provide urgent medical and surgical critical care. I'm delighted to say that Bupa Cromwell Hospital is providing remote access for all of our patients, and this has proved to be particularly advantageous in my practice. My patients can access me by telephone, but much more importantly by video consultation, and they can not only access me, but they can also access other consultants, family doctors and allied healthcare professionals within the hospital. Bupa Cromwell Hospital provides a facility for video remote consultation for patients using a platform called Visionable. This can be accessed via devices such as smartphones, tablets, laptops and computers. The patient needs access to a secure internet connection, and the platform provides protection of the patient's privacy and dignity. It is user-friendly not just for the patient but also for doctors and other healthcare professionals with whom the patient interacts. Understandably, there's a huge level of anxiety amongst patients about COVID-19, and many patients are discouraged from accessing healthcare. We have video remote consultation facilities, and all patients with problems should avail of that facility. And when recommended by their doctors, they should attend hospitals for diagnostics and treatment if absolutely necessary. All patients who attend Bupa Cromwell Hospital can be reassured that they are safe from contracting COVID-19 infection. The hospital has introduced a range of measures to minimize the risk to patients. Patients will have access to on-site swab testing, they will have their temperature checked, a brief history taken, and thermographic cameras are in place to identify whether or not fever is present. In addition, to enhance patient safety, they will arrive at one door as the entrance, and they will leave by a separate door. When they encounter staff, the staff will have the appropriate personal protective equipment to ensure that there is no transmission of infection either from staff to patient or from patient to staff.